Okay, so welcome. This is the breakout session on other healthcare courses. Yes, we've got both of the co-hosts. So people will have seen me in the previous session. We just introducing, if they could turn their cameras on, Mariam, who is a nursing student in Leicester, and Donna, who is a radiography lecturer in Kiel. So we do have a presentation to work through. I'll try and get this kept reasonably short because the main point of this is to try to deal with questions. Donna and Mariam, can I just check you're ready to do your parts talking to those presentations? And Mariam, you've seen the final version of it, have you?
Yeah.
Okay, because the bulk of what's in the presentation is Mariam's, I should say. So what we want you to do is think a bit about when you have students who have an interest in healthcare, but either aren't interested in the doctor role or clearly academically are not going to be at the level for pursuing medicine as a degree, then they have as much need of support in terms of finding information about their courses as the potential medics. Now, the selection processes might not be as complicated as for medicine, but they still need to know what these courses are looking for and make sure that they're preparing appropriately. So I'll just start sharing my screen. Right, can everybody see something saying healthcare courses at university? Donna, I can see you. Can you nod if you can see it? Okay,
Yeah.
great. So this has the affiliations to the people who are going to be talking. So I'm just going to make a couple of points at the beginning and then I'm going to hand over to Mariam to talk about nursing. As Margaret said in the previous session, there are 350 different careers in the NHS and they don't all come under these headings on here. And I would strongly recommend you and your students look at the NHS careers website, see what the range is, what these various careers involve. And you can also find there the details of how you qualify for them, what qualifications you need to do, what kinds of qualifications you need to get onto the courses. Some of these will be postgraduate courses, so you'll do another degree first and then do one of these follow up. There are some, as Margaret mentioned, physician associates. There are some alternative routes. So a lot of people do physician associate studies as a postgraduate course for 2 years after a science degree, but there are a few places where you can do it as an integrated master's over 4 years. So UCLan and Reading, for example, do that. There will be others. So as I said, what we want you to do is think about what advice you need to give to students who have an interest in patient care, but not the doctor role, or are not going to meet academic entry requirements for medicine. If I could make a plea here, as highlighted in red here, do not please encourage your students to pursue medicine just because they're going to get good A-level grades. That's not the primary criterion. They will need the grades, but there's an awful lot of other things they need to do, and they shouldn't be pursuing medicine unless it's really what they want to do. We're not going to have time today to talk about how you advise students who are interested in medical science rather than in patient care, but my email address is on there. I'm happy to answer questions you might have about that if you want to come. We mentioned the NHS Careers website, and you were told in the previous session also about the Studying Healthcare site, and I can't recommend that highly enough for medics, dentists and pharmacists. That is a very, very valuable sort of information. So, Mariam, I probably have to drive this now, so I'll have to advance the slides, but I'm going to hand over to you and you're going to talk about what the difference is between different types of nurses, what nurses do, and then something about midwives as well. All
right, awesome. So hi everyone, my name is Mariam. I'm a final year student nurse. I'm studying a dual registration course in adult nursing and mental health nursing, so which means I come out, well, this July with 2 nursing qualifications, which sort of gives me a breadth of opportunities where I can work literally in any setting, so A&E, forensics, community, GP, mental health units, literally anywhere. So I think nurses' role is a lot more popular because you see on Casualty, you see it on the media. When COVID happened, we got the claps every Thursday. So it's sort of, you know, one of the more traditional roles. But I think over the years, nursing has really, really evolved. And in terms of looking at career progression, so like I know some people that really wanted to be doctors to study medicine but never got the grades, but actually now once you qualify as a nurse you can go on to do specialty nursing and then go on to do advanced nurse practitioner, which takes you up to about band 8, band 7, which is almost similar to a registrar position. So you've got similar qualities as a doctor where you're diagnosing, you're prescribing, you're doing some interventions, you just can't get up to consultant level. Well, we do have some consultant nurses as well, but it's just you need some more and more experience to get to that level. As it says on there, nurses plan and provide medical and nursing care to patients in hospital, at home, in other settings, and they look after people that suffer from both mental and physical health conditions, amongst a array of other things. There's opportunities to specialise, so I've come across lots in my career, well, journey. So I've come across like diabetic nurse specialists, ophthalmology nurse specialists, you know, district nurses, literally any part of the body, there's a specialist nurse for it. I think that's one way to break it down. In terms of what the course includes, I really like mine because I'm quite a visual learner. So it comes with theory hours, a study block, where I think I've got a slide in later where, you know, it's the anatomy, physiology, breaking down, you know, the ethics of it, the legal point of view, professionalism. And then we have the laboratory side of things where we have clinical skills lab. Like you can see in the photo in the bottom right. So that's when I was like doing catheterization. So we have like simulations and life models where we actually, you know, do these things. And one of the beauty of nursing is throughout placement, you're looking after real people. So it's real lives you're dealing with. And it's quite rewarding that despite the challenges, you can see people come out the other side better, or you're aiding them in recovery, or you're the one there for them in their time of need, or even on their deathbed when they're about to take their last breath. You're the one there for them, comforting them and their family. So it's very rewarding. And of course, I have clinical placements, like I said, where I just go and consolidate a lot of the learning I've had in study block, and I can, you know, build on those theory and actually get to be more confident, proficient with my skills. Next slide, please. So these are the types of nursing degree options in the UK at the minute. So you've got single registration adult, which is the general, so gynecology, surgery, medicine, community nursing, they all fall under that, or child nursing, so you just focus on pediatrics. And then mental health actually covers both adult and child, so you can have child and adolescent mental health services. And then you have learning disability, which sort of cuts across adult, child and mental health, but it's looking more into people with learning disabilities or on the spectrum of certain learning difficulties. And this is a bit newer, but actually one of the nurses I met a few weeks ago said it used to be in practice years ago where you could study 2 registration of nursing, but you have to do one and then go back to do the next one. And it was usually common, people used to do adult, then child, or adult, then go on to do midwifery. But now you can study 2 nursing at the same time, like myself, and come out with either a master's degree because it's an integrated 4-year course, or you come out and then you can specialize afterwards. The most common mix for dual registration is adult and mental health, or child and mental health. I think a few universities, very, very few, does adult and child, but it depends on, you know, what the demand for it is. Next slide, please. So midwifery, I think a lot of people think of midwifery and they just think of, you know, children, but there's a lot of prenatal, postnatal and delivery as well. So midwives care for childbearing women, newborn infants, families, and it's across the whole spectrum before delivery up until after delivery. So they look after them in pregnancy, the birth, postpartum, and the early weeks of life. So we have community midwives that would go in and visit as well. In terms of the course, it's very similar to the layout of nursing, where they have both clinical placements and they also have theoretical like study blocks as well. There's lots of opportunities to specialize within midwifery as well. I've come across like say Gordan midwives, they're band 7s. So there's that opportunities to progress within midwifery as well. They work at birthing centres, hospitals, and lots of them have caseloads in community. I think one of the biggest difference in midwifery and nursing is a lot of them are more autonomous if they're not specialised. And some of them, a lot of them can do private work where they do a lot of the postnatal checks and they have to get their own cover. It is a rewarding job, but I like looking after adults, so it wasn't for me, but it is an option as well for students if they're interested in healthcare, particularly care of women and newlyborns. Next slide, please. So this is a common question that's asked a lot, that what if a student is interested in switching from nursing to midwifery, is that possible? Is it an option? Actually, once you're qualified with the Nursing Midwifery Council, because you already have a PIN, you can then apply to do an accelerated and shortened 18-month midwifery program. With that, you just, top up your cannulation, venipuncture, your fetal monitoring skills, just the added knowledge that you would have been exposed to as a nurse, because that isn't necessarily your patient group. So the 18 months is a time to touch up on all the necessary things. So afterwards, you be qualified as a midwife. And then one good thing about a lot of the allied health professions and nursing, midwifery, physio, paramedicine, radiography, is we do learn a chunk on placement or in clinical practice. So even though you might seem like, oh, I don't feel confident about this, but because we do go out to certain places, we learn on the job, it is refreshing for a lot of people. Because I know with things like medicine, for some schools, you have to be like really knowledgeable and get like really good grades in your theoretical bit before you go out to your practice. But actually, you still got that leeway to learn in practice, even though the things in theory don't sort of make sense, if that makes sense. Next slide. I think that might be it.
I think that's it for yours, yes. So just before we move on to Donna, if I could just reiterate some of the points Marian's made there. That last one is something we get asked quite a lot about, whether somebody's done a nursing degree can work as a midwife. No, they can't. So if somebody wants to be a midwife, they should be looking to get onto a midwifery degree initially. As you see, there is a conversion pathway. I don't know how many places there are available for that sort of route, but really people should know at the point of starting the university degree pretty much what direction they want to go in, and that there are different nursing degrees. So somebody who wants to be a nurse needs to be careful that they're applying for the right degree program for what they want to do after they qualify. This point also about practice-based learning is something that you need, and I'm sure most of you will be doing this all the time. You need to make sure your students are very aware of that. While there are some medicine courses, not many, where you will learn medical science before you start applying it to seeing patients, that's not going to be the case in most other healthcare degrees. You're going to be learning the theory you need in the context of seeing patients and seeing how the healthcare system works. So one of the points there is that there are different varieties of nursing and students need to apply for the right courses. There are other healthcare professions where there are similar considerations, and you need to make sure that your students are doing their research properly. So I'm going to move on to Donna now and ask her to talk a bit about radiography. And one of the things there is that there are 2 different types of radiography degree leading to different careers. So Donna, you're muted still.
Right. Hi. My name's Donna Holdcroft, and I'm the admissions tutor at Keele University for the radiography programme. So what I'm going to talk about today is basically how to be a radiographer. So there are the two options really. You could study for the BSc honours, and that when you've actually completed that, you're eligible to be registered as on the HCPC as a radiographer. But we also have pre-reg MSc courses as well, so it's kind of up to you which route you want to choose. There are two kinds of radiographers, and we're the same, but we're very different, if you like. We're the same because we're both managed or regulated by the Society of Radiographers and the HCPC, but we're different because it's different pathways. And unlike nursing, you can't go between the two. You can be dual qualified, but you'll basically need to start again. You can't do a top up as you can with the nursing. So diagnostic radiography, this is probably the one that you're more familiar with, in as much as we do plain film, and you start off as doing plain film and a little bit of CT and a little bit of MR, like on a general level, and then most radiographers then come to specialise in one of the specialities. So the specialities are CT, MR, ultrasound, radionuclide imaging, breast imaging. But basically what the diagnostic radiographer is doing is taking an image for somebody else to report on or to comment on when they first qualify as a diagnostic radiographer, and then they progress through the career pathway and take on extra responsibility, and I'll come to that in a minute. So the other pathway that you can take is therapeutic radiography, and the therapeutic radiographers actually undertake planning and treatment of cancer. They do kind of cross over a little bit in as much as they do something called PET CT. However, they use that for planning rather than for diagnosis as a diagnostic radiographer would do. As they mentioned before, they're both quite academically heavy courses, so entry requirement is around about 3 Bs at the moment, and one of those has got to be a science. You can take the foundation degree route, so it's not the end of the world if you've got students that have chosen different A levels, and they can do the foundation degree route, but it's still coming in, certainly at Keele, at 3 Bs. So it's a mixture, because we're regulated by the HCPC and the Society of Radiographers. We have to do a minimum number of hours, both academically and clinically. So we need at least 95% attendance, and we're doing a minimum number of those will be 1,300 in a clinical placement. So we have that means that we're assessed both academically and clinically. So academic assessments are the normal types of assessments, such as exams and reports, essays, and then in the clinical environment, you're assessed by trained radiographers, but then the university supports those radiographers and gives them extra courses to make them able to assess. And we also have a link tutor, so that's somebody that operates between the university and the clinical placement to just make sure everything's okay. Things like whistleblowing, safeguarding, etc. So once you've qualified, there's actually you become what we call a practitioner, and then most radiographers will then start to specialise, and then they will move into become advanced practitioners and also consultant practitioners. And consultant practitioners actually operate in their own workload. Advanced practitioners normally report. So my speciality is ultrasound, and I was an advanced practitioner, and then I'm actually qualified to issue my own reports within the boundaries of the trust that you're working in. I'm just trying to think, is there anything? I think that's about it really. If there's any questions anybody's got about being a radiographer, and because I'm at Keele, I'm also work very closely with the physios and the rehabilitation exercise scientists as well, so I'm able to answer any questions about those too.
I'll stop sharing the screen, and I just make a point about consultant roles, because this is something, again, students need to be aware of when they're thinking about post-graduation career pathways, that there are a lot of things you wouldn't think of as leading on to consultant roles, including public health. At Keele, for example, we have a public health degree, which is about epidemiology and patterns of disease and so forth. And there is within the NHS, a consultant public health practitioner role where you're involved in public health measures for controlling health hazards and reporting on spreads of infectious diseases and so forth. Would anybody like to ask any questions in the 5 minutes we've got left?